Dr. Franklin, Madam President, you have the floor.
Thank you so much. I just don't even know how to follow all that. I'm going to start by just saying, friends, family, honored guests, thank you for coming to celebrate the next chapter of the San Diego County Medical Society. I'm honored to be part of this society, which is viewed as one, if not the best, of the county medical societies in California. But before I go on, I want to thank just a few people. I would like to thank my husband, John, and our girls, Melody and Victoria, who supported me through my time away from our nuclear family, to help my second family, the doctors that make up this amazing county. I'm honored to stand before you, my second family, not because I'm different from you, but because I'm exactly like you. Like you, I'm happiest during the pure act of taking care of a patient. Like you, I've spent a decade or more training for my craft. And like you, I spent a decade or more trying to pay back my school loans. And like you, I work every day to keep my practice open, despite reimbursement rates falling. Like you, I fear the yearly congressional threats of draconian cuts to Medicare patients. Like you, I'm overwhelmed by the layers of bureaucracy involved in getting an authorization for a medication or a procedure completed for a patient that's necessary. And like you, I live under a constant threat of litigation. Not easy to practice like that. And like you, I fear the unknowns in the Affordable Health Care Act and its creation of an IPAB, the Independent Payment Advisory Board, and the state-imposed health benefit exchange. We don't know what it holds, but it's going to revolutionize our state and our country. And the most important thing to know is that we're going to have a seat at the table to make sure that things are done the way they should be for physicians and patients. Most importantly, like you, I stand here with our county and state medical societies to make absolutely sure that our voices are being heard in Sacramento and Washington, D.C. The strengths of SDCMS and CMA is that we're rich in the resource that counts most, physicians, united in speaking with one loud voice as an advocate for physicians and patients on core issues. It doesn't matter if we're primary care physicians, specialists, or surgeons. It doesn't matter if we work for Scripps, Kaiser, Sharp, UCSD, or the community clinics. It doesn't matter if we're in a small, medium, or large group. We are all physicians caring for patients. We have a core issue. As the complexities of cost and quality in healthcare dominate the news, I can think of no group better than physicians to sit at the table and fight for what is right for the practice of medicine and the advocacy of your patients. One of my favorite quotes is that if you aren't sitting at the table, you're likely on the menu. With your participation, your executive committee and board of directors at the local and state levels will help keep you and your patients off that menu. Every day around the clock, new rules and regulations on healthcare are being developed, often by people who've never even practiced medicine or have any idea what happens to a patient when they impose their laws on them. And every day around the clock, our organizations are standing at the front lines to speak on our behalf and on behalf of our patients. When Congress attempts to slash Medicare payments due to an outdated sustainable growth rate formula, which I actually call the unsustainable growth rate formula, we launch a full-scale campaign to stop those cuts. When there's even the hint of an attack on MICRA, we fight to keep malpractice premiums lower in our state and reasonable so that patients can still find a physician. When insurance engages in unfair practices, we go to court, we fight, and we win on behalf of physicians and the patient. It's in the best interest of our profession and our patient that we reclaim this sense of physician community that we've lost over the years. This community will then be empowered to sit at the table when healthcare issues such as patient satisfaction, performance standards, quality assurance, and cost effectiveness are discussed. Like you, I'm going to go back to work on Monday and see patients. And like you, I'll be working my hardest to care for them in the best way that I know how, with evidence-based medicine. The extra time I take to be part of this larger community of physicians is an honor. It's a responsibility. It's also my right and privilege. Join me, work with me to support SDCMS and CMA in Sacramento and Washington once again, so that they can hear loud and clear the voices of physicians and their patients. Don't let them forget that if we speak as one voice, rather than just through our specialty societies, they will listen. The more we divide, the more the message gets diluted. There are the same core issues regardless of what mode of practice or what specialty you're in. And if we all stick together, we will not have a problem. The issue is that we divide, and dividing and conquering isn't working. We need to speak as one loud voice. So please stand. I want you guys to join me in a toast to the doctors that make up the San Diego County Medical Society and the California Medical Association. And remember, when you sit back down, know that because of this physician community, you have a seat at the table. Thank you.
Thank you, Dr. Franklin.
Thank you.